Hello, good evening, and how you day? Welcome to another session of Ask the Doctors. My name na Frederick Unubohai, and I did privileged to be the host of this program. If you dey hear me, if you can hear me, I want you to tell me where you dey watch me from. If you dey watch this video after we don't end the live session, sorry we no go fit respond to you. Uh-huh. We no go fit respond to you. But if you know say you dey hear me now, you dey live with me, I want you to tell me where you dey watch me from. Oya, let's go. Everybody where they watch me. Oya, good evening. Tell me, where are you watching me from? Let's go, let's go. Today now question and answer. Question and answer session. So we go take your questions. If you get any question, please drop them here and we go try to answer you. Chiwendo, Catherine, good evening. Watching from Warri. Amaka, how far? Good evening. Prince from South Africa. Don Weezy from Lagos. Amaka is watching me from Lagos. We are now. Okay, so today we go take question and answer. We no go prescribe any medicine for you. And my co-host now, Dr. Israel. Dr. Israel is in the house today. So let me bring Dr. Israel up. Dr. Israel, good evening. How you doing?
I'm fine. Good evening. Happy Sunday.
Yeah, happy Sunday. Ernest from Italy. Ernest, how far? Okay. Last week we were not online. Many things happened. And one major reason why we're not online, now by the grace of God, we're online today. It's difficult to subscribe. We're trying to subscribe this platform, but because of the dollar issue, it's hard to subscribe. So ladies and gentlemen, I know say it a day hard for us. So I make we know they live last week. And even this week, we never see subscribe. Yep. So Collins from Edo State, Doran from USA. Okay, we did live on Facebook, we did live on YouTube. Anywhere you watch us from, you did welcome. This program now every Sunday by 8 p.m. West African time. Myself and Dr. Israel, we did here, we did teach, we did answer questions. Get any questions for us tonight? Ask your questions and we go try answer you. I beg, share this video, invite your friends, and let's start. Okay. Agama. Oh, sorry, good evening. We have a question here, Dr. Israel. He said, Doctor, there was a video you said a woman can't get pregnant when she is not on ovulation. Is it true? Okay, a woman cannot get pregnant when she's not ovulating, when she's not on her ovulation. So outside of the ovulation, no pregnancy. You're asking. Let me allow Dr. Israel respond to that question.
Okay, there are different ways to answer that question. So if you say is outside the ovulation, if the woman can get pregnant, if the woman meets the man close to the ovulation time, there's every tendency that it can be pregnant because during the what we call the fertile period, and we know the ovulation are just 1 day, but when the fertile mucus are present, the sperm fit spend more than 24 hours, and when it spend more than 24 hours, even before the ovulation reach, yes, the woman can get pregnant. Or sometimes when it can be say the woman don't ovulate already, the egg can actually stay 24 hours or to 48 hours. So if it can't be like say it happened that way, the woman fit still get pregnant. However, the second way to answer this question is that if this woman not the ovulate at all, then the woman not go fit get pregnant on her own, except they can't do any assistant for her. They can't assist her and using IVF or other means of assisting to take assist the woman before the woman go fit get pregnant. But outside that one, yeah, the woman may not be able to get pregnant.
Okay, Catherine, I hope you don't get the answer. If you just they come today, we they do question and answer, and if you get question for us, ask us your question. We will try answer you. But please note that many people they here. So if you ask question and we know you never reach your time, you're going to need to get patience. And I hope we don't answer your question, Catherine. Hmm? Yes, yes, yes. If there's another question here, good evening, Benedita. Good evening, Rachel from Libya. How are you? Okay, share this live. Share this live. Let's go, everybody. Share the live. So concerning the question, many women don't even know about their ovulation. They just believe that I did on my period finish, I meet my partner. It's important you know your ovulation, you know the signs of ovulation, you know your fertile window because you might just be knocking and you're not even knocking at the right time. Yes, okay, very good. Hmm? Let's see. Ask us your question. Ask us your question, and we will try. Oh yeah, share this live. Share the live. Let's see. Um, okay. My blood pressure is 134 over 66. Where is the lower one now going lower than the upper one? Dr. Israel, you want to respond to this?
Well, if your blood pressure is 134 over 66, I'm not sure so you get anything to worry yourself about. Just I will want you to just, I don't know your age, but just continue checking your BP as a regular thing that you do. But to me, you don't need to trouble yourself. I think you are still within the normal. So just relax your mind.
Yes, you've gotten the answer. You don't have any problem. Just keep on checking your blood pressure. Because we don't know a lot about you, but based on what you don't send us here, we don't think you have an issue like that. Nobody says the lower one is bad, and nothing about the lower one is bad. Your BP looks good based on the question here. Yeah. If you just come, you're welcome. We did answer questions tonight. Last week we were not here. We've been finding it difficult to subscribe. After today, we might even lose this account to subscribe. It's difficult. It's difficult to subscribe because of the whole dollar issue. But we're trying. We're hoping that we can sort this out. If you get any question, I beg, try ask us your question. Make we answer you. Good evening. Good evening. Shared. Olasukomi. Good evening. How you day? Agatha Ifoma. How are you? Okay. Okay. We have a question here. It says, please, doctor, is it good to give kids from 10 years old lemon water to drink? Dr. Israel, I beg.
Well, I don't know. When you say lemon water, I really don't understand that lemon water. Is it that one when is the normal water you just cut lemon and put inside, or which of the lemon water? If it's just the one that there is normal water, you just cut your lemon and put inside, and you serve it for the children to drink. I don't think there's anything bad in giving them that water to drink. Yeah, I don't think there's anything bad, except maybe there's other preparation you are doing to call and lemon water. But if it's just the one I explained, I'm not sure say it is bad.
Okay. Please ask us your question. This is the reason why we're here tonight. Um, Now we will want answer question. Normal water lemon. Okay, normal. Let me even go live on TikTok. Normal water with lemon. Okay, no problem. We have a question here. Now, this for this question where they ask us, I believe you know the answer, but you are asking us. No problem, we go answer you. Gozie Italo, if I got it well. He said, good evening, Doc. What are the causes of frequent urination? Dr. Israel, I beg, respond.
Many things fit cause frequent urination. I will start from if you drink water too much. Let's start from something like the normal. If you drink water too much, there's every tendency say you go to urinate frequently. First of all, what will be frequent urination? Frequent urination simply means say the person they urinate often and often more than the normal way when the person take they urinate. Yeah, and most of the time, now when for night you don't get up more than your normal time, if we consider this person they get frequent urination. So when you drink too many water, there's every tendency that you may have frequent urination, and that one is normal. That one go tell you say yes, your kidney they work very well. Another thing is that there are some drugs where if it cause you to get frequent urination, some hypertensive drug fit cause am. Then another thing is that if you get many sugar for your body, one of the signs, and when we see it, they find that if the person get so many sugar, now frequent urination, and that urination, you they urinate, they tasty, they gain weight. Yeah, we can actually want to find out why they urinate very well. Now another one can still be infection, and when infection they cause frequent urination, the person go they pee small urine, and sometimes you feel they get pain when urinating as well. Then for men, other things wey fit cause okay, sorry, before I go men, for women, pregnancy fit cause frequent urination because when the belle don big, e go hold the rest on top the bladder. So the bladder no go fit hold urine. So because the bladder no fit hold urine, the person go dey urinate frequently. Then for men, if e get prostate problem, if fit still get frequent urination, uh that na one of these symptoms wey go fit follow prostate issue. Now sometimes if person still dey get kidney problem, one stage of kidney problem fit become frequent urination before you come be say you no come dey urinate again, and so on and so forth. I think these ones when I just mentioned, I think there are still some few that may cause it, but these are the major ones where they common when if it cause frequent urination. So Dr. Fred, over to you.
Thank you, Dr. Israel. Welcome, everybody. We did live on Facebook, we did live on YouTube, and then I also did live on TikTok. Make we try to take as much questions as we can. Somebody says, Sunday, good evening. I just want to say thank you for the airtime last 2 weeks Sunday. I waited last week Sunday, but okay, last week Sunday we were not online because we couldn't subscribe every month to be able to do this live session on Facebook and YouTube. We did pay dollars, but we can't because of the Nigerian issue. That was why we were not online last Sunday. Even today, we never see subscribe.
Not
So
be
we
Falcon, not be AFCON, AFCON,
have
not get what you do to our subscription, our program.
to be AFCON. You understand? We understand that they're important events, but even if we will not be on, I will let you know. We've always been here, so no vex. Now dollar they mess us up. That is why. Hello, I like to know if there is a limit to the Maggi we can consume. I'm a bachelor and I usually consume Maggi a lot. So I would like to know what it contains and how often we should take it. Dr. Israel, over to you.
No, Dr. Fred, answer this one.
Now, there's been so much information going on about Maggi, the side effects, with regards to MSG and the rest. If it's possible that whenever you cook your food, you use crayfish, you use nutmeg, you use ginger and other things, fine. If it's possible, you get many people right now, they're not they use Maggi for their food. What they use crayfish, they use ginger and the rest, the normal stuff and your onions. But if you know fit and you must use Maggi, then we go encourage you, limit them, no use them. You understand? We are giving you two sides, so because some people go to say don't use Maggi. If you know say you know fit and your body, your food, you must put Maggi, reduce the amount. Try crayfish, try nutmeg, try ginger, try garlic, try cloves and the other stuffs to help your food because these stuffs actually we don't want them too much in your system. Huh? Good evening. Please, is it bad to add salt to plantain when frying? Please explain. Thank you very much. Dr. Israel, should I respond?
Yes, respond.
Okay. Normally plantain gets sweet taste. If you no put salt for your plantain goes to sweet. But over the years, from one generation to another, we believe that you must sprinkle salt inside. Now the problem is that some people don't even know the amount of salt to put. They go they pour pack the salt. And as medical professionals, we don't even want me you chop too much salt in your system because excessive salt will cause you problems. So we go advise try not to even fry your plantain with salt. Do your best not to do that. But we also understand that it is difficult for some people. Listen, medicine no be say you must. Some people no fit. So if you must, Celestina, I beg, little. I'm saying if you must, not as if I want you to, but if you must use salt, then put a little in your plantain because the plantain already dey sweet. Adding extra salt not be for the plantain. Now your body go harm. Do you understand? Hmm? Okay, we have a question here from Rita on Facebook. Rita Iyere says, "Good evening. My sugar level is 78 percentage. Well, that is not how we calculate sugar. I have been taking sugary drinks to boost it, but it's still the same." Dr. Israel, want to respond?
Okay, if your sugar level is 78, I don't think you should be troubling yourself. You're taking sugar drink, sugar whatever to boost it up. You are just taking it for taking sake. Now, let me ask you, what time do you normally do this sugar test? If it's in the morning, maybe before you eat everything, 78 is normal. Normal. The norm for fasting blood sugar, we know we have different type of sugar tests. We have the fasting blood sugar, the one you do in the morning before you take anything. That's at least by 8 a.m. you should have done that. Then we have the random blood sugar, the one you can do even when you have eaten something. And for the fasting blood sugar, the normal is between 60 to 110. So if you're having 78, it means that you are still within the normal range. You don't need to dey trouble yourself. Say you can't go to collect many sugar things. And another thing, you they sweat or you they get dizziness or you they feel like fainting. If you are not having all those symptoms, I don't think you make you dey worry yourself as well. Now, for all the last two questions, I was just laughing. That's why I told Dr. Fred say make him answer. So for that plantain, whether you add salt or you not add salt, it depends on you. But all we have to say for that one now, make you not add too many salt because salt can also cause other problem to you. But why must you add salt when you put your plantain for hot oil? It's already sweet. I don't think there's any need you adding salt. Now, too much of everything, I would say they bad. And your mangi, you don't need to put too much. Because there's many of all these things, when we never can know, people tell they could get cancer of different things. So all this refined product, we need to take them in a moderate form so that may we not by ourselves use and cause problem for our body. So, Rita, please, your sugar level is within normal, so I don't think you should trouble yourself. Thank you.
And if I may add, now who they advise una with this value to go be drink sugar drinks? Because I be like saying that somebody go tell you say you dey low, may you go drink. So I beg, dey careful with all these things where you they put in your body. If you know be medical professional advise you, their sugar level is fine. If you have any other opinion, see your doctor, make them check you. I beg. We have a question on Facebook. Oluwatoyin says, "Good evening. I have a friend that is pregnant. So she fell sick and she went to hospital for treatment. And the doctor said there is protein in her urine after she did a test, although it has been treated. But I want to ask this. What can what can cause protein in urine?" Dr. Israel, want to respond?
Okay, protein in urine. First thing first is that it's not really too bad for pregnant women. In some cases, you can see protein in their urine, but it should be in a minimal amount, small, very small. And because I even sugar self sometimes, because then the the urine formation not the two work perfectly. I use the word perfect, not saying not the work, but not the way fit everything because of the pressure when pregnancy they put for all of them. So everything one quick come out, everything one quick come out. So because of that, they fit see small amount trace of protein. But when you start seeing a lot of protein in urine, infection can cause it even in pregnancy. Then you get what we they call uh preeclampsia and eclampsia. They can actually cause protein in urine. So when you start seeing protein in urine, you need to be wary of preeclampsia. Whether this woman do they get a problem, then you need to see leg, whether a leg swell, and if the swelling for the leg, they pain her. So if all those things can they happen, and that woman need to they see doctor every time, because if possible, in some cases they may want to even admit the woman till e deliver. In some cases, so not be all cases. Then if you dey get that protein for urine and you can't get wetin we dey call fit, that is convulsion, just know say they go want bring down that baby immediately. That's if you don't reach time to bring down the baby, or they go want do anything to make sure say that baby, that woman and the baby they are alive. And if you still notice when you dey get protein for urine, you check your BP fit still go up, BP fit still go up. So it's just like a cascade. We have what we call pregnancy-induced hypertension. That one I fit lead to preeclampsia. Then preeclampsia will come lead to eclampsia. So when you don't see preeclampsia, it means say it gets protein for urine and it BP day up. Then eclampsia will come be say it BP day up, it get protein for urine and it can't get convulsion. Then you can't they call her eclampsia. So these are some few things wey fit cause protein for urine for pregnant women.
Thank you, Dr. Israel. Before we continue, people are not sharing the live. People are not, you understand? They know they share at all. It's surprising, like really, except few people. The rest of us know they share. Why? Why, guys? Why? Okay. What is the cause? Whenever someone make out with her man, after some days, he will start having fever. He will not be comfortable till he take drugs. He will be fine. Okay. But when he make out with her with condom, nothing will happen. But when he make raw, he will not feel fine. What is the cause? Dr. Israel,
Well, the answer now, I don't know what is the cause. If such person they get such problem, he should go to the hospital. He go and meet his doctor and make a complaint. If they are need to call both the two partners so that when they come run some investigation, they will come run some investigation, know if there's anything that's wrong that's wrong, and they will be treated perfectly. And sometimes I don't know, sometimes some people are just like that, but I think they need to see their doctor. That's the best advice for now.
if you just they come, you they welcome. We they do question and answer today. We they live on Facebook, we they live on YouTube, and I also they live on TikTok. I they take questions majorly on Facebook and YouTube. But if anybody get question for us on TikTok, please drop your question there. Myself and Dr. Israel, we're right here with me on Facebook. We could try and answer your question. I have also shared. Okay, thank you for sharing. Good evening, doctor. Please, is it good to take boric acid or to sit on hot water after menstruation to stop the bad smell?
First thing, after your menstruation, you're not even supposed to be having bad smell. Right? If you're having bad smell, it means that there's a poor hygiene. And so you need to take care of your poor hygiene. So when you take care of your poor hygiene, there will be no bad smell. So taking boric acid, sitting on hot water does not have anything to do for you. Just make sure you take care of yourself before and during menses. Take care of your hygiene level. Then after your menstruation, take care of your hygiene level. And I don't think you'll be having any bad smell and all that. It now depends on how many times you dey even change your pad, how many times you dey take your bath, how many times just know the hygiene level you need to take care of and in that aspect during that period, and then you know what to do. Then if you also be having pain, serious pain during this menstruation period, and you're having this kind of pain, please see your doctor. There might be another thing wrong, not just having the pain and not just having the smell alone.
Okay, thank you, Dr. Israel. We have a question from Salamatu on Facebook. There's a question on TikTok, but let's take on Facebook. Good evening. Is it normal for a woman to feel pain during intercourse?
Well, it's not normal for a woman to feel pain during intercourse. Now, there are some few reasons that can make a woman to feel pain during intercourse. One, if the woman is dried, eh, there will be pain. Eh? Two, if the woman is dried and the man was not gentle, there will be pain. And two, if there's an injury, there will be pain. Then three, infection can also cause pain during intercourse. So it's not a good thing for a woman to feel pain during intercourse. So if you think that your own is maybe dryness, you need to make sure two ways you can make yourself not to be too dry is one, maybe una go play well before the knacking, or two, get wetin they call lubricant. You use lubricant before the knacking, then the pain will not be there. Eh? However, if you can't be say after you do all those ones, you see they get pain, it means say you need to see your doctor and make complaint. So other things can be the cause of that. Not be only infection, but there are some problem with the uterus that can also cause make you to have pain during knacking.
Thank you, Dr. Israel. Before we continue, people they here, una know they like, una know they share. The only thing we una care about now to just come, ask question and run away. No be so that they do things. You understand? Yeah, as we dey watch us, so remember, we not even they ask you for any money. Like, share, invite your friends. Basically, that is all we are asking from you. But we notice say una know they send like that. Why? Okay, we have a question on TikTok before we go back. This person says, I saw my menstruation on the 6th. Please, when is my ovulation time? Thank you. Okay, let me respond quickly. BA, we know if we calculate your ovulation for you because there are many things to know about ovulation. If you want to know more about ovulation, you have to go to the page, watch many videos. You need to know the length of your menstrual cycle. Very important. And then, or you go download one app. Your menstrual cycle also has to be regular. And when you know them, you can now calculate it. But say you just come online, I saw my period on the 1st of January. When is my ovulation? No, that's not how it works. There are many things you need to know. Yeah. What's your Facebook handle? So go to Facebook or YouTube. On Facebook, type Dr. Fredosta Official. Let me just show you here. Dr. Fredosta Official. That is the name. On Facebook. On YouTube, Dr. Fredosta. So this is it. So let's take another question on Facebook. It says, please, is it possible for high blood pressure to be reversed back to normal?
Okay, when you say reverse back to normal, I don't understand, because if I say yes now, if I say yes, it go be like say you don't it's a cure. But the answer is, if you are on your medication, if the person is hypertensive and is on medication, your BP can be normal and can remain normal as far you are taking your medication. But once you stop to take your medication, the BP will go back, it will go up again. So the only way it can come back to normal now when you dey on BP medication and you are taking it regularly as your doctor tell you make you take am. But if you can't stop am, the BP will go up again. So reversing to normal, yes, but not be say it don't cure, because BP not get and not be BP hypertension, and like which is high BP, it not get cure. We the only fit manage am. Because now one of the chronic diseases, that's not one of the non-communicable disease that we have.
Yes, and I think I have an idea why she's asking, because I have seen people where they do advertisement for you and they will tell you, say, they can help you cure your high blood pressure. Doctors are lying to you. They don't want to tell you the truth. and then they package their advertisement so much that you fall for it. When you go there, you go surely buy something and know the cure BP. If you maintain a good, healthy lifestyle, all the things we want me you avoid, and if you take medication, if you're on medication, your BP go there within that normal range. But if you stop all those things, you leave them, you they do anyhow with your lifestyle, or you stop your medication, your BP go fly, go back up. Basically, that is what it means. Huh? Doctor, I want to ask you to take Primolut N to regulate my period. Hope it's okay.
Well, the answer to that question is please go and see your gynecologist and ask so that maybe you not go take what you can't regret later. Eh? So see your gynecologist. Uh, he will tell you if it is okay, and if there are other medication he want to give to you, he will also let you know. Hmm? Because there are other questions where you go need to ask you, and some other things where you go need to know before you go know whether that will be okay or not. More than not just the see drug for anywhere, just carry and use, please.
We have a question on TikTok. More will make them sharply because so many they hear. What causes steady heartburn?
You said
What causes steady heartburn?
steady heartburn. You say steady heartburn.
Yes, 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 yes.
What do mean steady heartburn? Okay, now heartburn. If you dey get time continuously, it means say you dey always dey provoke your stomach. Eh? So when you are having heartburn, many things fit cause am. If it don dey turn to ulcer already. So some food fit cause am. Some people go eat beans and they go get heartburn. Some people can take peppery thing and they go get heartburn. Some people can take gaseous things, drinks wey contain gas, and they go get heartburn. So you go find that some stressful activities fit cause heartburn. You don't eat for a long time can actually cause heartburn as well when you can't take something. So you go find out for yourself which of this category you fall put. So if you don't know the category you fall put, you don't know how you go take dey regulate yourself so that make you know they get this heartburn continuously. So but if you can't say they continue, abeg go see your doctor. A gastroenterologist will be the best person for you to see. He go examine you. If there's a need to do some investigation like endoscopy, it will tell you, and then they will give you the best treatment that you need.
Thank you, Dr. Israel. If you just did come, we did live on Facebook and YouTube and TikTok. We did take questions tonight. And thank you for the gift, Juliet Richard. People know they appreciate this kind of thing. Now, other things people they appreciate. It's all good. Somebody's asking us a question here. It says, which folic acid pregnant woman fit take?
Folic acid na folic acid. Anyone may take now the same folic acid. Folic acid now get different type. Eh? Folic acid is folic acid. It is better for this woman to start taking folic acid from the beginning of his pregnancy. For the first trimester, folic acid is very, very important because at that time all the part of the body they form, and folic acid is needed mainly for mostly for that time because it help for the formation of the body, so that make the body for form well, most to stop what we they call neural tube defect and all that. So folic acid is very, very important. Most mainly the first trimester, but other trimester it is also very good you take your folic acid.
Okay. We have a question here on Facebook from Daniel. Doctor, is this natural detox drink I always prepare for myself? I grind cucumber with ginger, mix the juice with honey. I take it once every morning before eating. Should I stop doing that? Let me allow Dr. Israel respond.
Well, what you are doing is okay, cucumber, ginger, or whatever, and onion. It's okay, it's fine, it's not bad. You can continue doing it. It's not a bad thing. It's just like you're taking it's just like you're taking juice. It's not, in quotes, let me remove something from your mind. There's nothing like, it's not any detox. I don't know, you're not detoxing anything. It's just like you're taking juice. Cucumber and fruits now. Ginger, and it's just it's a good habit. I will say that it's a good habit, and please keep it up. Continue.
I like that. Thank God. You see, the first respond because I know where Daniel was going. That word detox drink, my brother. Now juice you they drink, fruit juice. Now you they drink. That word where we they like carry for our head. I detox. I want to detox. So when you have that word in your mind, you feel like you are. I'm detoxing, bro. What you they do is healthy. Is good for you. Continue. But say you are detoxing. Uh-uh. You are just taking something healthy, and your liver, your kidneys, your lungs, your skin, they are all helping you to remove any toxin. I always share. Thank you for sharing. Good evening. Please, what can cause throat to scratch someone? Hmm.
Yeah, according to the weather where you did now, you should know that. I don't know if you're in Nigeria, but if you're in Nigeria, you should know that truth, they almost they scratch everybody nowadays because of the weather. The harsh weather can actually cause that. So when you don't, you won't get cough, and some people can also be having the inchy throat. So I would advise that when you are having that, take a lot of fluid, and take a lot of fluid. It can actually help you. It can actually help you. So in fact, this period, it will be nice for us to be hydrating ourselves well. That is taking water of any kind of fluid, but take a lot of fluid this period. Those of us in Nigeria.
Yeah, for those of us in Nigeria, take enough fluid. Somebody is saying cucumber na vegetable, garden egg na vegetable is not fruit. It no concern me. Whatever. We're not doing a nutritional class here. Whether now fruit or vegetable, that ain't my business. What I care about is that you are taking something healthy. You understand? Because we know they get time. It is a fruit. It is not a vegetable. It is a watermelon. In case you send us stars gifts, please let me know. Make we appreciate you. Um, to subscribe this platform, they give us challenge now with the whole dollar matter. Hmm? Thank you for those that are sending us gifts. Thank you. Good evening. How true is it that every woman? How true is it that every woman who menstruates ovulates? Okay.
Okay. Ovulation comes before menstruation. So once a woman is menstruating, is there's every tendency that is ovulating. However, there are some cases when some people fit not ovulate, but they go menstruate. And it go be say the body be they prepare for ovulation, but the ovulation fail. And because they prepare for ovulation, now make it still menstruate, but sometimes the ovulation fail. So the truth is that yes, if majority of the person that menstruate ovulate, but there are some persons that may have ovulation failure, and they not go ovulate, and they go fit menstruate. And also, if you are on family planning, most of the people on family planning, not they may not they not ovulate, even though they see their mens. The mens when they see, those are um contraceptive bleeding, and those are contraceptive bleeding that just they come as, they form as menstruation for most people. So so the thing is that yes, if you are menstruating, you are supposed to be ovulating, but in some cases, some people don't ovulate when they are menstruating. So when you are not ovulating when you are menstruating, it's a problem. So you need to see a doctor to correct that problem. And a gynecologist is the person you are supposed to see. Because if you not going to ovulate, it means that you not go fit give birth to a child as at that time. So see
Okay.
a doctor, and it go help you out.
Thank you, Dr. Israel. Our time don't they go. We don't answer your question. What causes steady heartburn? We don't answer your question. Sorry, we've answered you. If you are just coming, you do welcome. Can a pregnant woman take folic acid 2 times a day?
Okay, folic acid is taken once a day. Taking it 2 times a day is wastage. Eh? It's wastage. Because even that once a day, which is 5 milligram, when we they give, it's even more than enough that the body need. You get that? It's more than enough that the body need. So even that one, half of it they even waste. Talk less to say you can't go take 2 times a day. It's wastage. And it's like overdose. But once a day is the recommended dose for folic acid for any woman, not just a pregnant woman. Every woman in a childbearing age supposed to take folic acid.
Inyoma Christine, thank you for the stars you sent. Thank you very much. I appreciate you for the stars that you sent. I did drop those video for our private place. Una know the comments. Those of us we did the private. Una they look the video there, Abi. Okay. Waiting they cause hernia.
Okay, Dr. Fred, answer this one. Let's not
Hernia,
talk too much.
yeah. So waiting they cause hernia. Now, first of all, what is hernia? Hernia means that a part of the bowel or the body, it don't come out. So when there's a weakening, you'll be like, like this now. Something come out from the body and like balloon. A weakening in your abdominal wall, weakening. And most importantly, the cure for hernia now surgery. There's no tea. You understand? There is no tea that you will drink or you massage that will correct hernia. Anybody will get, there are different types of hernia, different types, so many types of hernia. The only cure for hernia now surgery. Anybody will tell you say get tea, say if you drink this tea go cure hernia. The person is actually just there to lie to you and take money from you. What month should a pregnant woman start using pregnant care medicine? The moment the woman is planning to get pregnant, she's supposed to start her medication before you even get pregnant. Tosin, woman won't get belle. Oh, I dey plan. Me and my partner, we dey plan to get pikin. We don't dey try. That time you're supposed to start. Not be even when you get belle. Now you dey start. Do you understand? It's important you start. It's called preconceptional care. Taking off your folic acid and other medications before you even get belle. That is what we advise. But we notice that some women, they go even get belle, they're not going to take. They go just they live their life, which is not okay because that baby way that they carry for belle, he need all these medicines early. And if you miss them, if you affect the pikin from the brain, the spinal cord, and other parts of the body. My 2-year baby swallow a coin today. Hope no problem. Dr. Israel, I beg.
Okay, if the baby is not having problem, maybe e no hang for a throat. Most likely go pass am out as stew. Go shit and come out. However, if as e swallow e dey get problem, abeg carry am go hospital so that make dem see how dem fit take remove am. But if you know it's not having problem, most likely you pass it out as stew. No fear.
I don't know how we allow that baby swallow coin. You understand? I don't know how. It's not nice, please. So what their best advice is put eye on that pikin now. Or just watch the pikin. Because that coin make it not go dey stocked anywhere. You understand? But if you pass through the pikin job, no problem. Okay, if you shit am. But if you know say the pikin when they get complain like that, make you go carry am go hospital, make them check am. My gynecologist was the one who asked me to take Primolut N. Okay, good, no problem. You're fine. Please, I have been having chest pain for a while, but recently, whenever I take chewing gum, the pain goes away. Please, why am I having the relief? Chest pain on the left side for a year now.
Okay, I think you need for this one. Don't they reach a year, and it's in the left side. Please see your doctor. Try to see your doctor. They may have a lot of questions to ask. I don't know why chewing gum they relieve am, but just you need to see your doctor. They may have a lot of questions to ask you, and you may be asked to do some investigation to check your lungs, your lungs and your heart. They may want to see those organ for your body. So with that, they will know if there's anything they will want to say or they will want to do for you.
Somebody sent me super sticker on YouTube. Doran Gilman. Um, Doran Gilman. I want to say thank you. Thank you so much, because a lot of people they appreciate us, and most of this money we dey collect for here, we dey use take do more content. So thank you very much for this stuff where you send. I see it and I'm grateful. Thank you very much. Um, we still have a lot of questions. Inyoma Christine and other people we subscribe to my private Telegram where they watch me. I'm sorry I mentioned your name, but I know say you did there. You be OG. Thank you for subscribing. Thank you so much. This subscription now they help us pay all these things online. Let's see. I always have headache whenever I finish my period, and until I take like malt and tin tomato before I will get myself. I don't like taking pain relief. What's the cause of headache after period?
Well, I don't think you even need those malt and tin tomato. That your tin tomatoes now make me laugh past. But I think once you just dey see your period, just they take your folic sorry, your blood medicine. Sorry, I mentioned the name of drug here, but just dey take your fesolate. That one will help you. You don't need all those many things. Most of the reason why you they get that headache, it might just be that your blood level don't reduce more. And I think there's a quick drop of your blood level that make you they get headache because your brain need this blood flow where they carry oxygen to the brain. So for some persons, for some ladies, once they are seeing their menses, that blood flow to the brain when they carry oxygen to their brain, it they reduce somehow, and because of that reduction, it will cause headache. So you need to replenish that blood that was lost during the menses, and that's where your blood medicine come to play. So you don't even need to wait till after the menses before you take it. And sometimes if you and sometimes if you don't also want to take those blood medicine, you feel they take a lot of fluid, take a lot of water and all that. So it will reduce the number of blood cells that is lost from your body. It will reduce the number of blood cells that you will lost. But the good thing is to just take your blood syrup and you'll be fine.
We have a question on TikTok. Can a woman with hernia go through pregnancy without doing the surgery?
Okay, depends on the type of hernia the woman is having. As Dr. Fresh talk, there are different type of hernia. Even sometimes some pregnancy can actually push out hernia, and but it depends on the type of hernia the woman is having. And hernia does not really cause a problem until when it is strangulated, and that is when it starts giving problem. So if it's not strangulated, it's not and you're not having problem with it, why you can't you go on with your pregnancy? You can do your pregnancy, and when you are ready for the surgery, you go and do your surgery for the hernia. But we are always scared make it not go strangulate, because if it strangulate, it will lead to blood loss. So that intestine where go enter inside the weakened place, it go lead to blood loss. And when blood not reach some place, now go the person go dey get pain, and the pain can be very severe and can cause anything. And because blood not still reach there, that part of the intestine will die, and then you can cause gangrene, infection, peritonitis, and all that fit even happen through that process. So the good thing is, if you notice any pain, if you don't notice any pain as you get the pregnancy for the hernia, I beg, it is nice you just go and reduce the hernia and help yourself. But you can actually carry your pregnancy to 10, even with hernia.
Okay, thank you, Dr. Israel. Please, I have a sore throat. I don't know what is the cause.
Well, if you get sore throat, if you're in Nigeria, most people get sore throat this period. So it's most of the time say if you don't get sore throat, maybe cough and catarrh one follow and come. And these are bacterial infection, viral infection, and all that. So you need to be hydrated, and you need to take care of your environment. Then with that, you'll be okay. You'll be fine.
Yeah. Please, if you know you are gaining value, if you know you are gaining value, if you are gaining, help us to gain value by liking and sharing. That way, we too will gain from you. You like and share. That is all we are asking for. We know say make you send us anything. If you want send, it's okay. But to support us, I beg, like and share. Good evening, doctor. Please, how can someone manage sickle cell anemia?
Sickle cell anemia. Okay. To manage sickle cell anemia is just for you to first of all not make sure say the sickle cell come to play. And then na first thing, not just allow am come. Eh? So it means say if you are AS, try not to get married to an AS if you want to give birth to it. If you want to give birth to child, eh? That na one way to manage am. But other ways to manage it is that any sickle cell anemia patient, any sickle cell patient, get their normal routine medications when they take. And the normal things when they need to do. Let that person they do those normal things. And if they do those normal things, take a lot of fluid, take their folic acid, their Sunday medicine for malaria, and try to run away from stress and all that. You not go get crisis. And if you not get crisis, you not go get problem. So because now their crisis might be their problem. So if you fit do all those things for that person, and the person not go get problem, and that's how you have managed the sickle cell.
Thank you, Dr. Israel. We are almost out of time. I wish we could stay more here because until we subscribe again, get us the matter go be. Good evening. At what month should a pregnant woman start taking? We've answered you. Good evening. Can someone waiting for pregnancy take coenzyme Q10?
Sorry, I don't know what to be called and Q10. Yeah, for me, I did like tell now the truth. Make I not go mash line. I don't know what is that, but I think if you are looking for pregnancy or you are waiting for pregnancy and it never come, just go see your gynecologist. He go tell you what to take and what to do. In fact, the first thing what you need to do for people waiting for pregnancy is to know your ovulation, is to know when is your ovulation. Some of us not get problem, just that we don't know how to time our ovulation. So time your ovulation, make sure you are having regular what we say regular knacking. Eh? Regular knacking. When I say regular knacking, mean that you must have at least 3 to 4 times in a week. That be complete knacking, and that knacking there must be a good penetration and a good ejaculation. So if there's good penetration and good ejaculation, then and 3 to 4 times in a week, then you are ready to become pregnant. Not be the one when you date Sokoto, your husband there Abeokuta, and on they meet once in 2 months, and you are saying you are not getting pregnant. But if even though you are doing like that and you are able to time when is your ovulation period.
Waiting happen to your network, Dr. Israel, because I know I don't even know what you're talking about. Okay. So we're talking about coenzyme Q10. Sorry, no vex, because waiting they talk, my mind not there. But let me answer your question. Coenzyme Q10, I don't see them online. A lot of people they tell you say make you go drink them. Number one, coenzyme Q10 na antioxidants, na like supplements. So if you're finding it difficult to get belly, like I don't know, maybe they try bump again. Coenzyme Q10 no go say because you drink them then you go carry belly. It's an antioxidant, and like supplements. And we no go even encourage you to just go market, go they drink coenzyme Q10 like that. Because I see people they can package this thing and advertise it for you. And if you're not careful, you go run buy them, thinking say it gets the solution to your problem because we know you need antioxidants. But I beg, if you find it difficult to get pregnant, maybe your ovulation, time them well, meet your partner, and everything being equal, you will get pregnant. But if you find it difficult to carry belly, see your doctor. Yeah. Can you get hernia twice? Yes. The answer is yes. You can get hernia twice. There's a question on TikTok. I want to be very fast because of time. Dr. Israel network don't affect him. It don't come out. How do person manage hepatitis B? The video is on my YouTube. I beg. Hepatitis B. Okay, Dr. Israel is here. Hepatitis B, to manage it, we've made videos about it. Me and Dr. Israel, we don't do many live sessions about hepatitis B. Try go YouTube and watch them. But you need to manage them. You need to know your viral load, whether it did plenty or not. If you know they plenty, they will monitor you, advise you on what to do. If it did plenty, they will give you antiviral agents. Okay, Dr. Israel, welcome back. Yes, you can have
Yeah,
twice.
thank you.
You can have hernia twice. You can. It's possible. Let's see. Is ulcer treatable? Yes, we have spoken about ulcer many times. It's treatable, just that sometimes it can be very chronic, can be disturbing. We say you go take medication for a long time, then you go avoid certain Harriet. So to know more, I beg, go to the page. You will see videos where we don't do about ulcer. But to manage ulcer is possible. But most importantly, you have to be sure what you get now ulcer. Because we they see a lot of people complain online. Then say I get ulcer. How you tell no say you get ulcer? Now scan I do. No. Scan no go confirm ulcer. The only way to confirm true if now ulcer you get now true endoscopy. So you have to be sure say what you get now ulcer. Then follow the medicine where your doctor give you. Follow the advice. Avoid anything that will cause you heartburn. And the ulcer by the grace of God go down. Can pregnant woman take BP medicine, Dr. Israel?
If the woman get BP, yes, he can take BP medicine, but they get the type when they go prescribe for the woman. They get the best type for pregnant women. So yes, pregnant women can take BP medicine.
Okay, we have a question. Our time on this live session is almost up. Please, doctor, on TikTok, why does this happen every month, a week before my period? I'm always upset. Why?
Okay. I don't know why you're there upset, but it's just an hormonal thing. It's an hormonal thing. I think your hormone now they make you there upset. And if you be person where you notice say yourself by yourself, say you not person where they quick get angry over something even before then. Most of the time when your hormones are really playing on you, you see they upset like that. So now hormonal thing. And so just try to look for things where go they calm you down so that make you not the day upset anyhow.
Okay. Please, doctor, the sore throat is over 9 months, and whenever I sing, my throat smell. Sore throat 9 months.
Madam, go hospital. Go hospital, please. You need to see the doctor for that. You never can tell what you are having in that your throat now. So just go to the hospital.
Good evening, doctor. Please, what could possibly cause excruciating pain from the waist area through the thighs of a man? The pain is serious. Kindly help.
Okay, if the pain is serious, I don't think it's the person that have that excruciating pain. I don't think it's the person that is typing. But if the pain is serious, as you said, please go to the hospital. Eh? Go to the hospital. Because if the pain is serious now you the type, it means say the pain not serious. That's what you mean. But if you're, as you said, the pain is very serious, please go to the hospital. They may ask you a lot of other questions. If you hit the waist for anywhere, your age, we want to know your age. We also want to know if you be one carry heavy load, you can't hear one sound for your waist. It can make boom. And we want to know all those things. So with all those questions, they will be able to know what and what to do for you.
We are almost out of time. But before we end, I tell for those who want to join my private membership, very important. For those who they ask me, please lecture us. Please lecture us. Not easy to lecture online, no. It's hard because a lot of things are. You want to have those special privileges. Subscribe. Look at my page. Link is there. Click on the link. Subscribe. Download Telegram. It will carry you enter the private Telegram channel. For there, you get so many benefits. Many, you understand? You could join. So what I did, you did TikTok, you did Facebook, you did YouTube. The link did the page. Look for Click on them. What I did in Nigeria, South Africa, Ghana, UK, subscribe and join. People did here. I want to end right now. You can watch the video on YouTube, yes, on ovulation. We have to go now. Let's answer one question for TikTok. Doctor, please, why do I miss my period for a month, then it later come back after a month? As we round up.
Okay, if you miss your period in a month, then you come back in a month. One thing you should know is that your period is not a monthly thing; it's a cycle thing. You want to ask yourself, well, how long is your cycle? With the kind of person where they get long cycle, there will be tendency say you feel not see your period one of the month like that. But you just have to find out what happened. And some persons, some things, if it be say not see am maybe because one thing happen, maybe belle be don enter and later it can't come out or one anything can actually have caused that. That's if you dey get normal cycle. But if you be person wey be say your cycle dey long, it's possible saying it's possible saying normal for you. So just try and find out, just look at yourself for this time when you don't see and the next time if you go see am for the next cycle and see how long is your cycle, then you'll be able to get a good complaint to make.
As we round up, the time is we don't spend 1 hour and 1 minute. Is it good for a person with anemia to take antibiotics? Dr. Israel, sharply.
Now, when somebody have anemia, you need to first of all you need to first see the word anemia. The way now they use the word anemia self, I dey fear. Now, somebody will get anemia, he go to hospital. You need to be in the hospital and make they correct that anemia for that person. Yeah, before the process of correcting the anemia, they'll start to dey look for wetin dey cause that anemia. So that's what they will correct. If the person need antibiotics, he can take it, but not be every time person need antibiotics. So if the doctor find out say he does not need antibiotics, there's no need giving that person antibiotics. But if he needs it, if they fit give am. But the first thing na to find why that person get anemia and correct the anemia as quick as possible before you go get another thing.
As we round up tonight, first of all, we want to say thank you for everybody who watch us. This program, by the grace of God, now 4 years we don't do one. And you get one thing where we dey always tell people. The habit of looking for medicine on internet is wrong. The habit of buying medicine from people on the internet is bad. Taking medicine on your own, it is very bad. Not because we won't show you say no, because we understand the implication. And a lot of people don't lose their life because of this. Not because they hear and not because they beg you. So no just go take medicine anyhow. Ensure say your doctor and they are aware. And if your doctor tell you say take them, please follow your doctor's advice. Take the medicine. You understand? If you no understand why, ask him. Now your doctor, ask him. Listen, we are saying this and we don't fear anybody. Don't be taking medicine anyhow on the internet or even from your friends, except now a medical professional give out to you. I beg. Dr. Israel, final words.
Okay, my final word is that what is Dr. Fred talk now true. I want to just also say make una beg um another one thing na make una no go hospital finish. The doctor don't tell you what you go do. You go come meet us for a year while they find out if you should do that thing. If we can't say no now, can't do it. We not be your doctor. We just they try to educate everybody. And so that's why when we talk to now, we dey always say go meet your doctor. So you have the right to ask your doctor any kind of questions. And two, we to get topics these days not they funny. So if you think say you get one topic when they trouble you for mind, when you think say we never address before, you can actually send it to us in any form you think you can reach us. And you feel just send that put for any of our video on that say Dr. Mukuna discuss this, and then we go look at it and see how we go take discuss those topics. Because to find topic these days, brain it dey hard for brain nowadays. Oh. And the third thing is that for us when in Nigeria, you can we notice say it be like say the poor heat for Nigeria this period. Everywhere is hot. Huh? So because everywhere they hot, they even make some people they irritated. They make some people even they quarrel, unnecessary quarrel, and all that. So let's try and they take a lot of water. Maybe they hydrate ourselves. Maybe we not they dehydrated because people they sweat anyhow these days. They sweat anyhow, so they can dehydration is one thing when if it come. So let's try to dehydrate ourselves. If you notice say you don't dey get headache and you dey feel like say you want fall, you dey faint, abeg try sit down one place and relax. Try sit down one place and relax. Not say I must rush go work, go kill yourself, because if you die today, that work will continue. So take life jeje. And if you take life jeje, you go fit do everything when you want do. So please, for us in Nigeria, try and hydrate yourself a lot. And as I dey even talk to myself, I don't finish like I don't finish water. I don't know how many I don't finish. I don't finish a lot of water here as I dey talk to una. So as I dey talk, so because it's not funny. The heat is not funny. So
Yeah.
please try and hydrate yourself, and don't worry, we'll be fine. And thank you so much for always being with us. If not be you, we for not day here. Now because of you, that's why we are able to talk all this talk when we they talk. For all of you where they give us gifts, they share coin and all that. Thank you a lot. You guys are doing well. Now well done. Thank you.
Thank you so much, Dr. Israel. Please follow Dr. Israel. Look at his handle on the screen. Follow him. And then somebody's asking me, when is the last day of our fruit challenge? The last day of our fruit challenge is the last day of February. On the 1st of March, I will make a video and announce the winners. So if you know, say you did do the fruit challenge and you did follow the instruction, on the 1st of March 2024, I will make a video, announce the winners, and give out money. So let me give you an expo. We are giving out more than 200,000 naira on the 1st of March for those that participated in the fruit challenge. More than 200,000 naira. The sponsors sent me money, so we are giving more than 200,000 naira. So on the 1st of March, I will make a video and announce all the winners. So if you know, so
What of me will not participate?
Excuse me. Nothing for you. So we will give out the money on the 1st of March on Facebook, only on Facebook. So follow me there. And thank you to all the gifters. Thank you to all our sponsors. Thank you to you all watching. This program is every Sunday by 8 p.m. to 9 p.m. The reason why I spend more time here now because me they not go ban this our subscription. If they ban them, so me could just burn the time before tomorrow. I don't know. Or go try subscribe again in dollars. Thank you. I appreciate you all. Now you're winning nothing. Take care, guys. Remember, good life now. Wait.
Nonsense.
Good life. Nonsense. Thank you to all my gifters. God bless you. Bye-bye.
Bye-bye.